Hello and welcome. Today we'll be diving into a serious and often overlooked kidney disease, Aristolochic acid nephropathy, or AN. We'll explore its causes, how it harms the kidneys, who is most at risk, and what can be done about it. This is a condition that can lead to irreversible kidney damage, so understanding it is crucial. The primary cause of Aristolochic acid nephropathy is exposure to aristolochic acid, or AA. AA is a naturally occurring compound found in plants of the Aristolochiaceae family. Historically, these plants have been used in traditional herbal medicines, often marketed as remedies for weight loss, arthritis, or other ailments. The danger lies in the misidentification of these plants, substitution of them for other herbs, or the deliberate inclusion of them in herbal remedies by unscrupulous manufacturers. The ingestion of these contaminated products introduces aristolochic acid into the body, initiating the cascade of events that lead to kidney damage. Once aristolochic acid enters the body, it's rapidly absorbed and metabolized. The metabolites of AA, particularly aristolactum, are highly reactive. These metabolites bind to DNA within the kidney cells, forming DNA adducts. This genetic damage disrupts normal cellular function and triggers a process of cellular death called apoptosis. Over time, this leads to progressive scarring and fibrosis of the kidney tissue, specifically affecting the tubular cells. This chronic injury results in a gradual decline in kidney function, ultimately leading to end-stage renal disease. Aristolochic acid nephropathy was first recognized in the early 1990s in Belgium among patients who had taken herbal slimming pills. This initial outbreak led to widespread awareness, but cases have since been reported globally, particularly in regions where traditional herbal medicine is prevalent. The exact prevalence is difficult to determine due to underreporting and misdiagnosis. However, it's understood that individuals who regularly consume herbal remedies containing aristolochic acid, or those who have been exposed through occupational means, are at a higher risk. The onset of aristolochic acid nephropathy can be insidious, meaning it develops gradually without immediately obvious symptoms. Early signs may include fatigue, nausea, loss of appetite, and weight loss. As the disease progresses, patients may experience more noticeable symptoms such as swelling in the legs and ankles, high blood pressure, and changes in urine output. Blood tests will reveal elevated creatinine and blood urea nitrogen levels, indicating impaired kidney function. A key diagnostic marker is the presence of aristolactum DNA adducts in kidney tissue or urine. Diagnosing aristolochic acid nephropathy requires a high index of suspicion, especially in patients with unexplained kidney disease and a history of herbal medicine use. The diagnostic process includes a thorough medical history, physical examination, and laboratory testing. Urine analysis can detect protein in blood. Kidney biopsy is the gold standard for diagnosis, allowing for direct visualization of the characteristic tubular damage and the presence of aristolactum DNA adducts. Mass spectrometry can also be used to detect aristolactum DNA adducts in urine or tissue samples. While there aren't distinct classifications or subtypes of aristolochic acid nephropathy, the severity of the disease is typically graded based on the degree of kidney damage and the stage of chronic kidney disease. This staging helps guide treatment and management strategies. The cornerstone of treatment for aristolochic acid nephropathy is immediate cessation of exposure to aristolochic acid. Unfortunately, the damage caused by AA is often irreversible. Supportive care focuses on managing the complications of chronic kidney disease, such as high blood pressure, anemia, and electrolyte imbalances. Medications like ACE inhibitors or ARBs can help slow the progression of kidney damage. In advanced stages, dialysis or kidney transplantation may be necessary to sustain life. Prevention is the most effective strategy for combating aristolochic acid nephropathy. This involves strict regulation and monitoring of herbal products to ensure they are free from aristolochic acid. Public education is crucial to raise awareness about the potential dangers of consuming unregulated herbal remedies. Consumers should be cautious about using herbal products, especially those sourced from unreliable sources. Healthcare providers should be vigilant in screening patients with unexplained kidney disease for a history of herbal medicine use. The prognosis for aristolochic acid nephropathy is generally poor, as the kidney damage is often irreversible and progressive. Many patients eventually progress to end-stage renal disease, requiring dialysis or transplantation. Recent research focuses on developing more sensitive diagnostic tools to detect AA exposure early on. Studies are also exploring potential therapeutic targets to prevent or slow the progression of kidney damage. For example, research is investigating the use of antioxidants and anti-inflammatory agents to mitigate the cellular damage caused by AA. Further research is needed to develop effective therapies to combat this devastating disease.